Imagine getting a device that works kind of like a pacemaker and having part of it put right into your brain. 6 Baptist Health patients in the First Coast here are getting this device designed to help them with neurological disorders such as Parkinson's disease and epilepsy. On Your Side's Haley Harrison spoke to a Baptist neurosurgeon who says this brain stimulator could be life-changing.
Dr. Bradley Wallace says the new deep brain stimulator, or DBS therapy device, is about the size of this sticky notepad, which is implanted in the chest and connected by wires to electrodes implanted in the brain. DBS therapy has been around, but Medtronic's new Percept neurostimulator not only sends outgoing signals to the brain to control neurological disorders such as tremors, but also reads electrical activity in the brain. Baptist Health System neurosurgeon Bradley Wallace says the device will ultimately replace the older versions that can't do this.
So it was already an awesome therapy. This sort of ability to read what's going on, with electrical activity in the brain is going to take it, I think, to another level.
Using this data, physicians can personalize a patient's therapy by adjusting the settings.
There will be thousands, probably tens or hundreds of thousands of patients that are going to be implanted in the coming years with this device. And these devices will allow ongoing collection of huge amounts of data that could have a big impact on our ability to treat those folks.
Dr. Wallace says the growing data pool could show patterns and open up doors for adaptive therapy. In other words, he believes in the near future, this device can figure out what's going on in the brain, send a stimulation, and stop, say, a seizure before it happens. In Jacksonville, Haley Harrison, First Coast News, on your side.